Assalamu alaikum wa rahmatullah. Our lecture today is about contraception, counseling and hormonal contraception. First, we must know that ideal contraception must be inexpensive, easy and simple to use with minimal side effect, rapidly reversible, readily available, highly effective, and can be administered by non-healthcare personnel. Contraception is a stepping stone for effective pre-pregnancy care, especially for high-risk women. How to choose the right choice? First, we must know the types of contraception, including natural family planning or fertility awareness method, including calendar, ovulation method, symptothermal method, and hormonal monitoring. Also, we have barrier method, including male condom, female condom, diaphragm, cervical cap, and sponge with spermicides. Also, we have combined hormonal contraception, including combined oral contraceptive pills, extensive period seasonal, including combined hormonal patch and combined hormonal ring. Also, we have progestin-only pills, long-acting reversible contraception, including non-hormonal and hormonal type. Non-hormonal including copper IUD and frameless IUD. Hormonal including injectable contraception, progestogen-only injectable, combined injectable contraceptive, and implant, for example Implanol and Norplant. Also, we have intrauterine system, including levonorgestrone intrauterine device. Lastly, we have sterilization, which is in female caused by bilateral tubal ligation, either hysteroscopic sterilization. Also, we have male, for example vasectomy, scandal and non-scandal. This table showing failure rate of various contraceptive methods. So, which one to choose? First, we will talk about natural family planning method. They include calendar or rhythm method, basal body temperature, cervical mucus method, symptothermal method, ovulation awareness method, lactational amenorrhea method, and withdrawal coitus interruption. What about calendar method? WHO defined calendar method is the voluntary avoidance of intercourse by a couple during the fertile phase of menstrual cycle in order to avoid a pregnancy. And we have also lactational amenorrhea method, and we'll talk about it later. How to measure calendar method? First of all, pregnancy rate of this method is about 40 per 100 women per year, which is a very high failure rate. General rules of this method: we must cycle length is recorded for the minimum of 6 cycles. Likely fertile days are then calculated, allowing for the survival of sperm and ovum. First fertile day shortest cycle minus 20, last fertile day longest cycle minus 10. For example, if the cycle of this last 3 cycles of 26 to 32 days, periodic absence should be practiced from day 6 to day 22. This calendar method requires long period of sexual absence, which is not available or not acceptable by many couples, and also provide low and varying levels of efficacy. Don't provide any protection against sexually transmitted disease. Also not suitable for cycle lengths less than 23 days or more than 35 days. Also not suitable for cases of PCOS, breastfeeding, menopausal symptoms, and women taking hormonal medication. What about lactational amenorrhea method? Exclusive breastfeeding during the first 6 months after last childbirth. This causes induced amenorrhea by high level of prolactin. Failure rate in this method is 2 in 100 women. Also, this lactational amenorrhea very effective for the first 6 months, But if we have no any contraception, it may be increasing the failure rate after these 6 months. What about hormonal contraception? We have many types of hormonal contraception. First, we have combined pills, progestin pills or mini pills, subdermal patches, injection, and vaginal ring. Our first object, which is oral contraceptive pills, they are worldwide used, very confident method, reversible methods. The dosage and regimen of estrogen is from 20 to 35 microgram per day. Better cycle control with higher estrogen dosage, but the efficacy is the same. Used for 3 weeks with 1 week gap when menstruation occurs. Formulation: I have 3 phases. Monophases contain fixed amount of estrogen and progesterone. Biphasic, fixed amount of estrogen, while the progestin increase in the second half of the cycle. Triphasic, the amount of estrogen may be fixed or variable, while the amount of progestin increase in 3 equal phases. Combined oral contraceptive pills is highly effective, 99.9% in preventing pregnancy. However, the user failure rate is from 3 to 9%. This is because infrequent intake or patient forget, which is the first common or most common cause of failure of these pills. 30% of women miss 3 or more pills in the first cycle of use. 47% miss 1 or more pills. Increasing body weight may decrease the efficacy of the pills. However, it is not proven. Indication: any woman seeking a reversible, reliable, quietly independent method of contraception in the absence of contraindication. What is the mechanism of action of combined contraceptive pills? It causes suppression of gonadotropin secretion, leading to inhibition of ovulation, which is the main mechanism. Also, development of endometrium atrophy, making it unreceptive to implantation. Also, production of viscous cervical mucus that impede sperm transport. Possible effect on the secretion, peristalsis of the fallopian tube, and interfering with ovum and sperm transport. What is the contraindication of using this combined contraceptive pills? I have absolute contraindication and relative contraindication. Absolute contraindication including the less than 6 week postpartum if breastfeeding, that is due to decrease the breast milk. Smoker, more than 5 cigarettes per day, more than 35 years of age. Hypertensive disease, including systolic blood pressure more than 160 mm mercury or diastolic more than 100 mm mercury. Current or past history of venous thromboembolism, ischemic heart disease, complicated valvular heart disease, pulmonary hypertension, atrial fibrillation, subacute bacterial endocarditis. History of cerebrovascular accident, migraine headache with focal neurological symptoms, current breast cancer, diabetes with retinopathy, nephropathy, and neuropathy, severe liver cirrhosis, liver tumor including adenoma or hepatoma. What about relative contraindication? Cigarette smoking less than 15 cigarettes per day, adequate controlled hypertension, which is systolic blood pressure from 40 to 159 mm mercury, diastolic from 90 to 99 mm mercury, migraine headache of more than 35 years of age, currently symptomatic gallbladder disease, mild liver cirrhosis, history of combined oral contraceptive related cholestasis, medications that interfere with oral contraceptive pills metabolism. In these cases, we must use contraceptive pills, combined contraceptive pills, with very caution and close observation. Also, we have non-contraceptive benefit of oral combined contraceptive pills. It used in cycle regulation, decreasing menstrual flow, so decreasing anemia, increased bone mineral density, especially in postmenopausal women, decreasing dysmenorrhea, perimenopausal symptoms, acne, hirsutism, ovarian carcinoma, 50% after 5 years of use, decreasing endometrial carcinoma and risk of fibroid, possibly decrease ovarian cyst, functional ovarian cyst, possibly decrease benign breast disease, possibly decrease colorectal carcinoma, and also decrease the incidence of salpingitis or incidence of severity of premenstrual syndrome. What is the side effect of combined oral contraceptive pills? There are minor side effects commonly occur during the first cycle, which may lead to unnecessary discontinuation. They include irregular bleeding, called breakthrough bleeding or spotting, occurring in 10 to 30% in the first month of use, improve within time over 3 cycles, amenorrhea occur in 2 to 3% of the cycles. Breast tenderness and nausea improve with time, less with lower estrogen dosage. Also, we have weight gain. Placebo-controlled trials have failed to show any association between weight gain and combined oral contraceptive pills. Mood change. Women report depression and mood change. Also, we have risk of combined contraceptive pills, which including venous thromboembolism, which from 3 to 4 higher fold in user than non-user, which also absolute risk of venous thromboembolism is very high, especially during the first year of use than subsequent years. Incidence of venous thromboembolism in non-pregnant women is increasing by decreasing age. The risk is attributed to the estrogen component of the pill and decline with lower dosage of estrogen. Also, we have a risk of myocardial infarction. They are associated with higher estrogen content. In the past, the pill containing more than 50 microgram ethynyl estradiol having 3-fold increase in the myocardial infarction. Recent study with pill less than 50 microgram ethynyl estradiol, no significant increase in risk. Also, we have stroke. They also associated with high estrogen content due to venous thromboembolism. Also, gallbladder disease, because combined oral contraceptive pills increasing the secretion of cholic acid in the bile, so increasing the incidence of gallstone formation. Breast cancer, still controversial. A large meta-analysis study showed that significant increase in the risk of breast carcinoma in women currently taking the combined contraceptive pills. Also, we have cervical cancer risk. Actually, the main cause of this is the protective effect of combined contraceptive pills with intercourse. So, they probably due to increasing the risk of human papillomavirus infection, which is a major risk factor for cervical carcinoma that may relate to sexual behavior with which different user and non-user of combined oral contraceptive pills. The user may have or feel safe to have multiple sexual partners with increased risk of human papillomavirus. This is cause increasing the risk of cancer cervix. How to manage these troubleshooting problems? First, breakthrough bleeding, to continue on the same pills with the exceptional that it will improve with time, rather than switching to another preparation. If bleeding persists beyond 3 months or new onset of bleeding in a long-term user, rule out other causes of bleeding. For example, irregular taking of the pill, which is the most common cause of breakthrough bleeding, pregnancy, infection, uterine or cervical pathology, malabsorption, diarrhea, vomiting, concomitant use of medication interfere with hormonal contraception. How to manage? Oral estrogen Premarin 0.25 milligram or estradiol for 7 days. Change the another preparation with different progestin. The second item, which is missed pill. Take the pill as soon as you remember. This means take 2 in 1 day. If 2 pills are all missed in the first 2 weeks of the pack, take 2 pill per day for 2 days. If 2 pills in a row missed in the 3rd week of the pack, through the remainder of the pack and start a new one using backup concentration in the first 7 days of the new pack. If 3 pills in row missed, follow up steps above. If intercourse occurring after missing pill, use emergency contraception. What about amenorrhea? It occurs in 2 to 3% of users. Pregnancy should be ruled out, which is the most common cause. If it is not dangerous, no need for re-examination. If not acceptable by patient, change preparation. Add oral estrogen for 10 days. Colasma, darkening of the facial skin due to estrogen content. We can manage it by changing to another preparation, will not help. It may never completely disappear. The use of sunscreen to prevent further darkening. Breast tenderness and galactorrhea often resolve with continued use. Decreased caffeine intake may help. Decreased estrogen content. Galactorrhea is rare. If it happens, check prolactin level. Nausea will be decreased with time, taking the pill with food or bedtime. Decreasing estrogen content, if it occurs in a long time user, rule out pregnancy. Pregnancy pills must be stopped immediately. There is no increasing risk of birth defect. The second item we'll talk about, which is progestogen contraception. We have many types of this contraception, including progesterone only pills or mini pills, injectable contraception, Depo-Provera, implant, Implanol and Norplant. Also we have levonorgestrone releasing intrauterine system, progesterone emergency contraception, progesterone only pills. I have 2 types of pill: 35 pill bag containing 300 levonorgestrone and 28 pill bag including 75 norgestrone. Also we have a new item which is called Cerazette, it's a trade name, contains 3rd generation of progesterone desogestrel, 97% inhibit ovulation, window of period of 12 hours instead of 3 hours, taken every day with no break, useful for younger women who don't wish to take estrogen containing product, or women who cannot relate with POPs. Mechanism of action of progesterone only pills: it suppresses ovulation, reduces sperm transport in upper genital tract through fallopian tube, change endometrial making implantation less likely, thicken cervical mucus preventing the sperm penetration. So, contraceptive benefit of POPs, including few side effects, confident and easy to use, client can stop use, can be provided by trained non-medical staff, contain no estrogen. Non-contraceptive benefit, including may decrease menstrual cramp, may decrease menstrual bleeding, improve anemia, protect against endometrial cancer, benign breast disease, ectopic pregnancy, and protect against some causes of PID. What is the limitation of POPs? Causes a change in menstrual bleeding pattern, some weight gain or loss may occur, user dependent, require continued motivation and daily use, it must be taken at the same time every day, forgetfulness, increase in method failure, resupply must be available, effectiveness may be lowered when certain drugs for epilepsy, phenytoin or barbiturate, or TB, rifampicin are taken, don't protect against sexually transmitted disease. Who can use POPs? Women of any reproductive age, of any variety, including nulliparous women, who want effective protection against pregnancy, who are breastfeeding 6 weeks or more postpartum and need contraception, who are postpartum and not breastfeeding, who are post-abortion. Who shouldn't use POPs? If it is pregnant, known or suspected. Condition required precaution are not recommended unless other methods are not available or acceptable. If a woman has an explained vaginal bleeding only if serious problems suspected, had breast cancer, current or history, is jaundice active and symptomatic. Condition require precaution is a drug taken for epilepsy, for example phenytoin and barbiturate, or TB, have severe liver cirrhosis, have liver tumor, for example adenoma and hematoma, has had a stroke, has ischemic heart disease, current or history of. Side effects which may require management including amenorrhea, bleeding or spotting, heavy or prolonged bleeding, lower abdominal pain with or without symptoms of pregnancy, weight gain or loss, headache, nausea, vomiting, and dizziness. Progestin only injectable, Depo-Provera. The immediate action of progesterone only injectable is thickened cervical mucus, which then present an obstacle to sperm penetration. Also, ovulation is impaired. There are additional changes in the endometrium that make it unfavorable to implantation. However, the first two effects make fertilization highly unlikely. Efficacy: the reported failure rate of progesterone only injection are low and came within a narrow range of 0.1 to 0.6%. Advantage: highly effective method of contraception, very effective reversible method, confident non-intercourse related, can be used by women who are breastfeeding, can be used with women who had a history of ectopic, non-visible, so can be an advantage to some clients. Disadvantage: once administered it can be withdrawal, menstrual irregularity, weight gain, delay in return to fertility, 60% to conceive in 12 months, 85% in 24 months, depression, breast cancer risk, and long-term use, smoking, and bone density is affected. The last option we'll talk about in progesterone only contraception, which is implant. We have three types of implant, with the most important is implanon and morplant. Implanon inserted subdermally in the groove between biceps and triceps in non-dominant hand, about 8 to 10 cm from the medial epicondyle, can be administered up to day 5 of menses without need of additional contraception. License for 3 years. Efficacy may be lower during the 3rd year in the overweight women. Inhibit ovulation by prevention of LH surge. Also affect cervical mucus thickening and endometrium. This is the point which is will put the implant. The benefit of implanon: independent of user compliance, rapidly return to fertility, more than 90% of women ovulate within 30 days, efficacy not being affected by broad-spectrum antibiotic, and failure rate less than 0.1 per 100 women per year. Side effect of implanon including menstrual disturbance, 2.5 to 5% of women suffer from alopecia, emotional liability, depression, self-depressive symptoms, and dysmenorrhea. More than 5% of women suffer from headache, acne, and breast pain. Little or no increased risk of venous thromboembolism. No evidence to suggest clinically significant effect on bone mineral density. Prophylactic antibiotics to prevent endocarditis are not needed for insertion and removal of the implant. If your patient is scared about depression, cancer, breast, skin disorder, and weight gain, so we must use emergency contraception. What is the types of emergency contraception? We can use copper IUD, can be inserted up 7 days after intercourse. Levonorgestrone 0.75% millimeter mercury in 2 doses, 12 hours separately, or 0.5 milligram single dose, have a similar effect. The other method: 2 doses, 100 microgram estradiol and 500 microgram levonorgestrone. Hormonal contraception must be started as soon as possible, maximum 5 days. Woman should be evaluated for pregnancy if menses doesn't occur after 21 days. Mechanism of action: hormonal contraception interfere with ovulation. Other mechanism could be interfere with sperm mobility or transform endometrial receptivity, fertilization, or zygote development. Yasab mechanism effective 70% in reduction of pregnancy. Levonorgestrone 89% reduction. IUD are more effective 98.7%. Side effect: levonorgestrone have lower incidence of nausea, vomiting, and dizziness and fatigue than Yasab. Thank you.